or on the floor, goes like this. So you have the toes, and you just want to scrunch and spread the toes. You see, so these goes scrunch and spread, scrunch and spread. If you're sitting on the floor, it's best that you have the hands behind your hips a little, fingers angled out and chest up. Try not to sink down into your rotator cuff. And at the same time, don't arch your back. Keep the chin in. Okay, so toes scrunch and spread. Now we're doing this a little quickly at this moment, just basically for circulation. And try to incorporate all of the toes, including the baby toe, and see if you can spread it and scrunch and spread and scrunch. There is an arch in the forefoot. So here in this part of your foot, there's an arch right here called the transverse arch. So when you scrunch, you would like to try to feel like that. Can you see when you do like this? So there's an arch in there. A lot of us, that arch drops and people get pain on the top of their foot and sometimes fractures in the metatarsals just because that arch drops. Okay, so next I'm going to do ankle flexion and extension. So you just like this now we're moving the ankles, okay? If you're on a chair, keep the heels on the floor as you do this and integrate the feet, the toes in me. So do spread and scrunch the toes as you are bending and straightening your ankles. And if you're sitting on the floor, just keep those arms strong, chest up, and chin in. Everybody chin in. And here, as we go through this series, the toes, so the ankle, right? You don't want to be out toeing. So your feet shouldn't be angled out. You want the feet centered. Okay, so next we're going to work on the toes individually. So you take your foot and then you take the big toe, the next toe, and bend them in opposite directions. We're going to work all the individual toes. Try not to twist the ankle, so your ankle should be still kind of straight like that. Don't like twist your foot out. And I know depending on hip mobility and other factors, you might not be able to reach your toes very well. In a chair, you might be able to do something like this. But we do want to be able to actually move our toes around with our hands. The next two toes, that we have the most proprioceptors in our feet and our hands. So when we can connect those two, we'll wake up our nerves. The next two toes, if this is a bit uncomfortable, often it's because the skin is just too tight. And as you do it regularly, the skin, next two toes, the skin will become more elastic and it will be more comfortable, and you'll be able to move the toes a lot and without discomfort. Okay, switch feet. So big toe and next toe. And the next two toes. So this is right where the anterior arch is. So you need to be able to move those two toes independently. And sometimes people get overlapping toes, right? So this will help spread them. Next two toes. The toe knuckles, try to straighten them. As you're doing this, keep the toes straight. I hold on to the toe knuckles so that they don't bend. Next two toes to try to help prevent from hammer toes building up. So all of these things are going to help your plantar fascia. Okay, from here we're going to stand up. And we're just standing, and I'm going to move the camera so that you can just see the feet more clearly. This first one, you might have to sit in a chair. Okay, so we go big toes down, other toes lift, other toes down, big toes lift. And you can do 1 foot at a time. And if you can't do that, you hold the big toes, lift the other toes, hold the other toes, lift the big toes. And you can do that, like I said, sit in a chair and just hold the toes down and try to help. Now you'll notice what you get a bit of ankle rotation with this. So this is really building up the plasticity of your plantar fascia. Plantar fascia is this under the arch, like between your forefoot and heel, all the muscles under, or the tissues under there. And when our feet get weak, it like tissue paper, it starts falling apart and then gets irritated and inflamed. Okay, so then next we're going to take the feet a little wider, not too wide though, just a bit wider than hip width. We're rocking through the ankles. So you're not twisting your hips, you're not twisting your back, you're not twisting the knees. It's just a slight rotation through the ankle joints. So there's a bit of a rotation, but this. Okay, and now we're going to go through a massage ball. So you can use a massage ball. There's another thing called a soulmate that works really well. But something that you can step on to put pressure on the plantar fascia. One thing that works really well is like a broomstick. So if you have a broomstick, we'll just like this walk, take small steps across the broomstick. When you first try this, it can be quite excruciating. If you do these kind of things regularly, like this doesn't hurt at all, actually. I can't hardly feel it. And the first time I tried it was, like I said, excruciating. And now the ball, so ball is good, but if you can get something more firm or different that doesn't move around, so I have this rock, it's some kind of a pumice stone. So you just can stand on it and you see you can put pressure in different parts of your arch. The ball, you can roll it around and you can put a little pressure, but something like this rock, you can really press down to remold your plantar fascia. And okay, now we'll switch feet and just put pressure into your arch a bit. Different angles, all different angles, right? Okay, so there are 3 arches in our feet. There's this one in the middle, we all know that. And then this one here that I mentioned, that's anterior arch. There's also an arch there. That's the lateral arch, you see like this. And this lateral arch is where we have the most proprioceptors in our feet. Okay, that's where you get the most nerve endings. And when we sit and our feet pronate, right, our feet go like that, then we lose pressure on the lateral arch. And because of that, the nerve endings die off because we're not using them. And that's where you get the most sensitivity for balance. So if your lateral arch nerves are shut off, you're not going to have good balance. So you see that's, I'm here and pressing down on the outside arch, in between the heel and the baby toe, like that. And also on the front arch, right? So I'm kind of wrapping the forefoot around this rock to get into that anterior arch. So I'll do the same on the other foot here on the lateral arch. And then on the anterior arch. And obviously we've already done this medial arch. Okay, so there now that was our remolding soft tissue. Next we're going to you need a rolled up towel. There's something called a toe pro that we use regularly. You can use that or the soulmate again. So I'm just standing up, okay? I'm going to show you the feet, but I'm just really standing vertically. So first we're going to work on just stretching the toe box, the toes themselves. The toes should be somewhat straight. You don't want the toes to be like curling up here, okay? So you have only the forefoot. See that? Only the toes are on it. And then you step forward and back a few times. So when you do this, try not to curve around your leg, like curving around like this. See, this back foot that's moving should go directly forward and back. You can see that? Directly forward and back. Don't let your body twist in the hip joint. Okay, now we're going to stretch. You step forward and bend the toes and lift the heel with the legs straight. Back and bend into the big toe. And also make sure all the toes, ideally all your toes are up. Depends on your feet, but like I said, the toe knuckles here should be straight, not clawing. Okay, now we'll switch feet. Okay, so all the toes are up and forward and back, even the baby toe. And then bend the toes, keeping the legs straight. And definitely press into the ball of the foot if you can do that, if it's not too painful. And then make sure also the baby toe, you're bending. Okay, so next for the calves, you step over with the foot on it this time, only the heel down. And then you step forward and back. And now we're going to step around. So now this time the front foot, you step around the front of the other foot. Keep the back leg straight and the big toe down. Don't let the big toe roll up. So you're stretching around the ankle, and okay, you should feel this around your ankle joint depending on you, but ideally inside of shin. Switch sides, so we'll have the other foot up. So the foot is up, heel down, and step forward and back. And then step around and hold, keeping the knee straight. And you know, if you've sprained ankles or you walk with a gait where the feet are imbalanced, then you might know it's quite different on both feet. But with regular practice, you'll even out your feet, your gait, and your entire body. Okay, and now rest. Okay, now lastly, I like to do a couple of things just to integrate that whole system, the body, along with what we just did with our feet. If you would like to, it's good to use a rolled up sock or a hacky sack. I'm just going to slide my foot along the floor. The first action is you slide the foot forward and back. So we're standing on the left foot, right foot, the toes are on the floor, forward and back. Just see, you'd like to keep the toes always on the floor. Okay, and now we'll switch. So left foot, right foot is supporting and left foot is sliding. Toes forward, keep the toes on the floor. Only the toes. Or toes and forefoot. But not the heel. Okay, and now something like a speed skater side to side. So we're going to do cross behind, keep the foot close to the heel, and then out to the side. Here the foot is directly in line with the other foot. You don't bring the foot back like that. Your pelvis is always square. So we'll go left foot supporting, right foot cross behind, then out to the right, cross behind, and again, it's the toes are in contact. That's why the hacky sack or the sock really help out. Okay, and then switch. Right foot supporting, toes are forward, left foot, cross behind, out to the left. The body weight is always on the leg that's not moving. Don't shift body weight to the moving leg. Body weight always on the non-moving leg. And rest. And now lastly, you just spread your toes, press them onto the floor, and do a bit of a hip hinge. And lift the heels. Keep the toes spread. And hold. So now we're lengthening and strengthening the toes, and your plantar fascia is getting stronger, longer and stronger. So this kind of series every day will really help with any kind of foot problems. And rest.